So yeah, I just want to introduce somebody. I've not known her that long, but I'm proud to call her my friend, and I'm relieved that she's an ally and she's on our side. Nothing more to say. I'll let Claire take it from here. But you know, 3 million Twitter followers before they took her down, 16,000 people on LinkedIn. So she's doing an amazing job at the minute behind the scenes, and she's here now to go into a little bit more detail. Okay, so it's my pleasure to welcome Clare Evans.
I'm not a public speaker at all, but I'm here to tell you my story. I'm a nurse of 26 years. I qualified in 1999, and from the beginning I started to battle corruption in health service. I've been battling it for the whole time. First of all, it was the management. They brought in alternative management from healthcare workers. They were government players basically, and everything started going wrong. Government started controlling the NHS. They brought in a new complaint service. They set it out all around the world. Everyone in the health service felt vulnerable. People were complaining about things which no one could manage, and the problems spiraled and escalated. In the first 5 years, I found out the HTU wards were overspilling with ventilation patients. I'm a respiratory nurse, by the way, of 26 years, experienced in chronic disease and general medical conditions. So back in around 2005, we set up the first ward-based ventilation systems for overspill from HDU. I found out why that overspill was happening. It was because of a training issue. Basically, they were mismanaged en route to hospital. Until now, this has never been rectified. Everyone knew back then what was happening and no one's changed it. Now we've got this crisis. People being ventilated for no reason. Following that, I went on to become a community matron for chronic conditions, hospital avoidance, and basically managing multiple complex conditions all at once. What I discovered there was most of this is actually reversible. It's medical negligence. I had a caseload of 30 patients. They didn't even fit the chronic disease register when I'd finished with them. Following that, I went in 2015 while I had my children into a care home. This was when the problems really started. I was on maternity leave and I went back and the management had changed, and we got systematic elderly abuse in a care home, which I reported. I whistleblew to public services, to police, social workers, and everywhere through the right channels. I was sacked on 5 counts of gross misconduct at that time. I took it forward. I went with the Royal College of Nursing and took it to court. I actually in 2017 won in court the biggest whistleblowing case in the UK. That was when the problems really started. I did continue in care homes at that time. I didn't think I'd get a job, which is why I took it to court, because of the bad reference. I carried on. I had 5 nursing homes closed, one after the other, after the other. They went into special measures. It is not a place you would send your enemy, let alone your family. Now our government have locked these people down, alone, knowing everything that I exposed at the time. I've taken it to the highest level in government and parliament. In 2017, when I won, I went back to social workers, police, government and parliament to tell them that this case needed reopening. I'd got new evidence, and by rights the Nursing and Midwifery Council should have reopened this case. There are nurses still hanging around that cause these problems, people still working in our systems that cause these problems, police and social workers that hid these problems. And do you know what? They took my children to shut me up. They took my children away. For the last 5 years, I've been battling for my children back. They took them without policy, procedure, court orders, court rulings, or anything. They just literally took them. After 3 rounds of fighting, I ended up with PTSD. I managed to find a solution to that in 8 weeks. So this is where all the solutions come from that are being hidden from the public and where I'm finding them. Okay? I stood up, got back up again. 1 more round, I wrote to every single member of parliament and Derbyshire County Council holding them all accountable. They just handed my children back just like that. No court order. On my birthday, on the 27th of December, both my children were together for the first time. My youngest child has now got mental health issues, severe mental health issues, but I know we can sort them, but no child should ever have to go through this, ever. So in 2017, I went out and I was working in GP surgeries. I was doing pop-up clinics to train GPs and practice nurses and do clinics for chronic respiratory patients, those with asthma and COPD. What I discovered in that position was that COPD is a man-made condition. It is caused by medical negligence. It is medical negligence of asthma. It's nothing to do with smoking. It can be eradicated in the future. It can be reversed over time. Asthma can also be managed totally symptom-free. So now we are developing a new World Health Organization by the people, for the people. Every system that I found out to be true, that works, that people are being brainwashed about by the media, told that doesn't work and everything else, is all going to come out. And what we have found is just truly astonishing. I can't go into this here now because the police, the government, social workers, they have tried to have me killed in my own home. And that's how I ended up with PTSD. However, I'm back now and they're not going to do it again. We need to stand together as a freedom movement. We need to unite. We need to get a new World Health Organization together because they are now going to take over full pandemic management of us, of the world in the future, and we have to stop this now. They are corrupt. I took these solutions at 90% less cost to taxpayers in October 2019 to the World Health Organization, global government, and 16,500 global leaders on LinkedIn, and they delivered a scamdemic. They delivered us a scamdemic, and here we are now. It was a vaccine agenda which I have been shouting out on my social media since January 2020. I have been giving out leaflets today. This is a new World Health Organization, so any single person can join this, whether it's a member of the public who's sick, whether it's somebody that's got an alternative solution, a real solution, a therapy, anything, a piece of equipment, anything. The collaborations we are making behind the scenes is immense. We just need you all on board. Everyone jump on that website. It's www.defyhealthsolutions.com, and it's by the people, for the people. There is no control here by anyone.